Total bed bath. Total bed bath is for comatose patient, paralyzed patient, bedridden patient, or any patient who can't move well or cannot move at all. Purpose of total bed bath is for blood circulation, refreshment, personal hygiene, and relaxation. Before proceeding to the room of the patient, always check the chart for the patient's profile, room number, any doctor's order, medication, or any important notes that you need to know so that you can prepare the necessary materials that you will be needing. Knock on the door 3 times for courtesy. This to inform the patient, relatives, or any visitor that you are entering the room. Greet the patient cheerfully and inform them about the procedure you're about to do. Then, turn off any cooling agents and open the windows for circulation. You can now prepare the materials needed in total bed bath. Materials needed are cali pad, dipper or bidet, bucket or pail, laundry hamper, kidney basin, eye mask, ear covers, thermometer, wet wipes, liquid soap, shampoo, comb or brush, cotton buds, pickup forceps, cotton balls, feminine wash, lotion. You will also need oral antiseptic, tongue depressors, lip balm, and then towelettes, tree basin, rubber sheet, bedpan, new set of gown, towels, underpads, and diaper. Before starting with any procedure, make sure to do proper hand washing to eliminate any contaminants that may pass from caregiver to patient and patient to caregiver. Make sure to rinse and dry your hands properly, then wear a clean gloves. Take the temperature of the patient, but first, clean the thermometer from the cleanest to the dirtiest, so from the bulb to the body. Do it for at least 3 times. If the temperature of the patient is 37.5 and above, do not proceed with the total bed bath. Do a tepid sponge bath instead and report it to your supervisor. Assuming that the temperature of our patient is 36.7, we can now proceed in doing the total bed bath. Starting with the face, get lots of cotton balls soaked in clean water. Proceed in cleaning the eye first from inner canthus to outer canthus. Do it for at least 3 times. Then forehead to nose, small C or cheek to chin. Do it for 3 times or until it's clean enough. Big C or forehead to chin, S, then inverted S. Clean the nose and ears with the cotton buds. Proceed now in the oral hygiene. Soak padded tongue depressors in oral antiseptic. Place towelettes in the neck and side of the face of the patient to prevent her gown from getting wet in case of any spillages. Open the mouth with the tongue depressor. Get the padded tongue depressor and clean the upper and lower palate, tongue, inner cheek, gums, and lips. Don't forget to pat dry, then remove the towelettes. Lower the side rail for your own comfort to apply proper body mechanics. Remove the top sheet, then cover the body of the patient with a towel. Raise the side rail for patient safety, then place her in a side lying position. Untie the gown from the back, then place her back in a lying position. Hold the towel near her neck while removing the gown from her arms, then pull it all at once near her feet. Fix the towel afterwards. Place the pillow to the side to give space to the helipad. Put the patient diagonally to her bed. Place a towel in her pillow and rolled towel in her nape to neck to prevent her pillow, bed, and gown from getting wet. Comb the hair of the patient from tip to top and check the scalp condition. Put an eye mask to prevent irritation on the shampoo and water, then ear covers to avoid any water getting inside the ears. Mix shampoo in a dipper with water. Pour it in the hair of the patient. Massage the hair with your fingertips for blood circulation and to remove any buildup dirt. Rinse now with clean water. Make sure there's a bucket at the bottom of the helipad to catch the water. Remove the eye mask, ear cover, and rolled towel. Cover the head of the patient with a towel, then place her back at the center of the bed. In a basin, prepare a clean water, soapy water, and clean water again for the final rinse. Expose only the part that is being cleaned. Starting with the neck, clean water, then soapy water, then rinse. Don't forget to pat dry. Then with the arms, start with the one farthest from you. Put a rubber sheet then a towel. This is to prevent the bed from getting wet from the procedure. Cleaning should start from the distal to proximal down to the axilla to promote blood circulation and venous return. Soak the hands now in clean water. Then clean the interdigital spaces and fingers in soapy water and rinse afterwards. Don't forget to pat dry. Proceed now on the other arm with the same process. Clean the arms from the distal to proximal down to the axilla to promote blood circulation and venous return. Soak the hands in clean water, clean the interdigital spaces and fingers in soapy water, and then rinse, and then pat dry. You can change the water after cleaning the arms if the water is now cloudy, dirty, or too cold for the patient. Clean the upper torso. Make sure to clean thoroughly, especially under the breast and the side of the patient, since this is where the sweat accumulates more often. Pat dry, then cover the upper torso again with the towel. Proceed in the back of the patient. Raise the side rail for patient safety, then place her in a side lying position. Put rubber sheet then a towel to prevent the bed from getting wet. Start cleaning the back now in a lateral or circular motion to promote blood circulation. Don't forget to pat dry. Do bronchial tapping to relieve the airway of the patient since they are more often lying in a one position. Change again the clean water, soapy water, and clean water for the final rinse. Expose only the part that you will clean. Start with the leg that is farthest from you. Place a rubber sheet and a towel to prevent the bed from getting wet. Clean from the distal to proximal down to the inguinal area to promote blood circulation and venous return. Pat the leg dry with the towel. Then, proceed on the other leg with the same process. Again, clean from the distal to proximal down to the inguinal area. Pat dry with the towel. Place a rubber sheet, then a towel in the toes. Soak the toes in clean water to break out any dirt buildup. Then, clean the interdigital spaces and fingers in the soapy water. Lastly, rinse with clean water and pat dry. Proceed now in the last part of cleaning. Raise the towel up to the hips of the patient. Place the leg in a lithotomy position, then remove the diaper. Scrape any fecal material with the diaper, then clean it initially with the wet wipes. Roll the diaper, then set it aside to weigh later if needed in the documentation. Insert a bedpan together with the rubber sheet. The bedpan will serve as a catch basin if in any case the patient will pee or eliminate while you are cleaning the genitals. Cover the patient while preparing the materials. In a basin, mix water and feminine wash. Put a rubber sheet and a towel in the area between the legs. Then put the basin. Always put your materials where you can easily reach them to save time. With cotton balls and pick-up forceps, clean the genitals of the patient. Since our patient is female, do the lateral or parallel stroke or do the 7th stroke which is shown. Do a number 7 stroke from the symphysis pubis down to the anus. Then, don't forget to pat dry. Remove the basin and the bedpan. Then, place the patient in a lying position again. Start dressing the patient. Put the gown above the towel. Then start inserting the arms afterwards. Pull the towel gently from the bottom. Place the patient in a side-lying position. Tie and secure the gown of the patient. Then, roll the used underpads and gently insert it in the sides of the patient. Remove the glove since it's already dirty and throw it in the yellow bin. Place a new set of underpads. Make sure that the bottom of the patient will be centered. Insert the excess part in the sides of the patient and on top of the used one. Then place a new diaper and carefully put the patient in a lying position again. Remove the used underpads and fix the diaper of the patient. Fix the gown and position of the patient. Then remove the towel in the head of the patient and comb her hair from tip to top. Put lip balm to avoid chapping of the lips, and lotion to the body to prevent the skin from drying. Put the top sheet again and take the temperature of the patient to see if the procedure is successful. One important note, complete the total bed bath within 8 to 10 minutes since the thermoregulation mechanism with this kind of patient is compromised. Then don't forget to do your documentation and aftercare.